Hey, how's it going? Bryson here from Lumino Health. Being a caregiver for a parent or grandparent is rewarding, but let's be honest with ourselves, sometimes you may feel a little overwhelmed. You might find it tough to navigate through the information and systems that are out there available for you to support your loved one. Not to worry though, here at Lumino, we're here to help. We sat down with our partner at Elizz to answer the top 5 questions commonly asked by new caregivers like you. So let's see how we can help. The number one question asked by new caregivers like you is there financial assistance available to me as a caregiver? And the answer is yes. In Canada, the primary financial assistance that you will receive is in the form of a tax credit. Here are a couple of federal government tax credits that you should know about. The first is the Canada Caregiving Credit, and the second is the Compassionate Caregiving Benefit Program. You can also look into seeing if you're eligible for a disability tax credit. Nova Scotia is the only province currently that has a caregiving benefit program. The next question asked by caregivers like you is, where can I find help and what kind of help is out there? Well, we've put together these few easy options to support you and your loved one. The first is to call a family meeting, just so that everybody knows exactly what they have to do to take care of your family member. Second would be to give your family doctor a call and see what kind of suggestions they give for taking care of your loved one. The third would be to check your insurance and benefits package at your workplace to see if you have any available coverage. This may be funds or even to have a personal support worker. The fourth would be to ask for a home care health assessment. That's through your provincial health authority. The fifth would be to reach out to your local member of provincial parliament, your MPP, and see what kind of government services are available to you. And finally, you can call 211 or visit 211.ca and learn more about resources. This phone number and website is available across most provinces in Canada. The third question commonly asked by new caregivers like you is, what do I do when my family member is given a diagnosis? For example, dementia. With any diagnosis, it's important to educate yourself on the disease. Here's a few steps that you can take to get started. First would be to call your family doctor and see if they have any suggestions on taking care of a person with that diagnosis. Second would be to check online for any support groups that might be in your local area. The third thing you could do is check for any relevant organizations, for example, the Alzheimer's Society. These organizations have great resources and information to learn more about the diagnosis. Another question asked by new caregivers like you is, how do I get my family to help out with the caregiving? This one is a tough one, because usually there's only one primary caregiver in a family. But don't stress, because we have a few tips on how to get your family involved with the caregiving. The first tip would be to hold a meeting. A virtual meeting is good because this will allow for family members that may not live in town, or if your family lives all spread apart, so everybody's present. The second thing would be to have an agenda for that meeting. And some things to have on that agenda would be a list of all the healthcare needs that your parent or grandparent is going to need to be looked after. Also, you'll want to have a schedule so each family member knows what they're responsible for. And finally, if there is a family member that is not able to care for your loved one, it might be a good idea to see if they're able to contribute financially. And for this family meeting, it's a good idea to have your parent or grandparent that is in need of care be present and join that meeting. The third tip would be to share up-to-date medical records with the entire family so everybody is in the know. If at this point you still think that you might not be able to lead this discussion or this meeting, it might be a good idea to reach out to an elder mentor. And remember, each of your family members has a different relationship with your parent or grandparent, and they'll define their obligations and responsibilities according to that. The bottom line is, you're in control of your relationship with your loved one, so it's not a good idea to try to change or control your family members. The fifth and final question that new caregivers like you ask is, how does home care and long-term care work? Well, first off, you're going to want to do a little research to learn more about these healthcare systems. But it's important when doing that research on home care and long-term care that you're using a reputable website, for example, Family Caregivers British Columbia. Also, you can ask more questions on these healthcare systems during your initial home health assessment. Again, you can reach out to your local MPP and see what kind of government services and supports you might be eligible for. They should be able to also help you with the application forms, which is an added bonus. Another great resource that you should take advantage of is a caregiver coach or a system navigator. They will know the ins and outs of home care and long-term care. I'd like to say a big thank you to our partners at Elizz for sharing and answering the 5 most common questions they hear from people like you, new caregivers. If you're still looking for more information on caregiving, I would suggest taking a look at our caregiving guide, Caring for Older Adults. If you're looking for general health resources, please check out luminohealth.ca. Both links will be below. And thanks again, and until next time, please stay safe.